Welcome to this explainer. An emergency can literally strike absolutely anywhere. You could just be at the grocery store or hanging out at a family barbecue, and suddenly everything changes. We tend to think that saving a life requires a paramedic with a bunch of fancy gear, but the truth is, bystanders are always the first ones on the scene. So today, we're going to explore the absolute essential foundations of life support that empower you to step out of that bystander paralysis and actually buy someone vital time.
To put things into perspective right away, this is an incredibly sobering stat. 4 to 6 minutes. That is exactly how fast irreversible brain damage begins when the brain is deprived of oxygen. Meanwhile, emergency services can easily take 10 or 15 minutes to arrive. So that gap in time, that's the ultimate battlefield. The actions you take in those few minutes are literally what keep a person's brain alive. So imagine this. You're the first person on the scene. Those terrifying initial minutes belong entirely to you. And hey, it's completely normal to feel a massive surge of panic. Anyone would. But our goal here is to replace that panic with a really clear mental game plan. Ask yourself right now, if someone collapsed in front of you this very second, would you actually know the exact steps to keep their blood pumping?
Well, here's the absolute game changer from the source material. Being untrained does not equal being helpless. Not at all. When you call 911 or whatever your local emergency number is, the dispatcher on the other end isn't just a receptionist. They're a trained professional who will literally coach you on speakerphone and guide your hands while the ambulance is en route. You don't need a medical degree for this. Your primary job is just to take action. All right, let's jump right into section 1, check, call, and care. This is the universal Red Cross sequence. You're going to want to burn this specific sequence into your memory like scaffolding for an emergency. First, check. Safety is a huge priority here, so make sure you don't become a second victim, and then check the person for responsiveness in 10 seconds or less. Next is call. And a pro tip here, don't just yell into a crowd. Point directly at someone and say, hey, you in the blue shirt, call 911. Finally, care to your level of training, treating whatever life-threatening conditions you've just found. When that call happens, exact location is your #1 priority. Think about it. If they don't know your specific floor or cross street, they literally can't help you. So give them the location, then calmly explain what happened, how many people are hurt, and what their condition is. Answer every single question the dispatcher asks, and never, ever hang up first. Okay, so what if the person is actually awake and responsive? The guidelines recommend something called the S.A.M interview to gather vital clues. That stands for signs and symptoms, allergies, and medications. And here is a really crucial takeaway. You want to perform this entire interview without moving them. That is absolutely vital if you suspect any kind of head, neck, or spinal injury. Moving right along to section 2, when the heart stops. Let's get into CPR and AED basics. Now here is a detail that I found genuinely surprising. Sometimes people who have just collapsed will make these occasional, agonizing, gasping sounds. That is not actual breathing. Do not let it trick you into thinking they're okay. If they are unresponsive and they are not breathing normally, you have to start CPR instantly. Send someone to grab an AED and get your hands on their chest right away. For hands-only CPR, which is the standard for bystanders, you kneel beside them, bare their chest, lock your elbows straight, and really use your upper body weight. You're aiming for a rhythm of 100 to 120 compressions per minute, which famously is the exact beat of the song Staying Alive. You want to push deep, about 5 to 6 centimeters, let the chest fully recoil, and just don't stop until help arrives or an AED tells you to. But you might be asking yourself right now, what if it's not an adult? How does this protocol shift if the victim is a baby or a little kid? It's a really great question, because obviously a child's physiology is quite different and requires a slightly modified approach. So this breaks down exactly how things shift. While hands-only is fantastic for adults, kids and infants truly need those rescue breaths alongside shallower compressions, provided you're trained to do so. The standard rhythm there is 30 compressions followed by 2 breaths. For children, you push to about 1/3 of the chest depth. For infants, you're just using 2 thumbs or the heel of 1 hand, going about 4 centimeters deep. But hey, if you're ever in doubt, hands-only CPR is always infinitely better than doing nothing at all. Okay, let's talk about AEDs, because I know they can look like intimidating pieces of hospital equipment, but they are virtually foolproof. You literally cannot use it wrong. It will absolutely only shock a heart that actually needs it. You just turn the machine on, and a voice will literally talk you through every single step. You stick the pads onto a bare, dry chest, stand completely clear while it analyzes the rhythm, and if it says to shock, you press the button. Then you get right back to CPR compressions. Next up is section 3,
choking, we'll be looking at the 5 and 5 method. If someone is coughing loudly, that's actually a good sign. Just encourage them to keep coughing. But if they're completely silent, they can't speak, cough, or breathe, and maybe they give you that frantic, wide-eyed nod when you ask if they're choking, you've got a life-threatening blockage on your hands, and you need to launch into the rapid-fire 5 and 5 method. Here's how it works. You're going to alternate between 5 firm back blows right between their shoulder blades using the heel of your hand, and 5 sharp abdominal thrusts, pulling in and up just above their belly button. You just keep alternating those two motions until the object flies out. If they happen to pass out, you lower them gently to the floor, call 911, and immediately start CPR. But real quick, what do we do if that standard hold just won't work? Obviously, you can't really do deep abdominal thrusts on absolutely everyone, like a heavily pregnant woman, for instance, or a tiny baby. The sources are really clear on these special cases. For pregnant individuals or larger adults, you strictly substitute those abdominal thrusts with chest thrusts, right on the center of the breastbone. For infants under a year old, you never use abdominal thrusts. You rely on back blows and very gentle chest thrusts. And hey, what if you're choking and you're completely alone? Dial 911, leave the line open so they can hear you, and thrust your own abdomen over the back of a firm chair. Moving to Section 4, Shock, Allergies, and Recovery. Let's talk about the systemic emergencies. There is a really important physical distinction to make here based on what's happening to the person. If they are unconscious but they are breathing totally normally, you want to roll them onto their side, into the recovery position, to keep their airway open and clear. But if they are in shock from a trauma, like they're super pale, clammy, breathing rapidly, their body is basically shutting down. For shock, lay them flat on their back, keep them warm with a coat or blanket, and definitely do not give them any food or drink. Now, anaphylaxis, a severe allergic reaction, moves terrifyingly fast. If you spot spreading hives or they complain about a tight throat, do not wait. You need to use an epinephrine auto-injector immediately, pressing it firmly into their outer thigh. You can even do it right through their clothing. Only after that do you call 911, and then just be ready to administer a second dose in 5 to 10 minutes if they aren't getting any better. Which brings us to Section 5, the ultimate takeaways. Let's distill all of this down. We've covered a ton of ground today, but if you forget literally everything else from this explainer, just please keep these 3 anchors in mind. First, always secure the scene with check, call, care. Second, for CPR, push hard and push fast to that 100 to 120 beat. And third, for choking, aggressively alternate your 5 and 5. All of this information isn't just medical theory. It's the exact proven protocol that buys crucial time for the human brain and body. Until those paramedics arrive with their equipment, the power to sustain a life is literally in your hands. So the next time the unthinkable happens right in front of you, are you going to stand by, or will you be ready to step up?